We now have a drug that many regard as a miracle. It can prevent HIV infection. It's highly effective. There are very few or even no side effects. And according to a report in The Lancet this week, if we gave it to gay men, we could prevent 10,000 new cases of HIV by 2020. Because PrEP isn't available on the NHS, a growing number of gay men are buying it online. Like this. This is the generic version of Truvada. You can buy it off the internet, import it from India and other countries, and it costs just a fraction of what you pay on a private prescription.
Generic PrEP is only a stopgap until the NHS provides PrEP for free for those of us who are most at risk of getting HIV. I think it's a scandal that we're in 2016 and we've known for 4 or 5 years how effective PrEP is.
Already many gay men are taking PrEP and saying so on their dating app profiles. Sometimes it's to show that they won't say no to someone just because they're HIV positive. And sometimes it can mean that they're interested in having condomless sex. Either way, it's beginning to break down the barriers between HIV negative and HIV positive men.
PrEP's had an amazing impact on my life. I now don't have the same anxiousness around HIV that I used to, and the same anxiousness around sex. Because I know that I'm protected, I now do not need to have that awkward conversation asking such a personal question to someone to ask them if they're HIV positive or not, because I know that I am protected against HIV and that I'm not passing it on to other people.
For me, the NHS is letting gay men down. It could easily make PrEP available, and it's not doing so. This is negligent. We have more than 6,000 new cases of HIV a year, and around half of those are of gay men. The battle for condom use has been lost. It's time to look elsewhere for answers to the HIV epidemic.
That was Patrick Strudwick, and joining us now to discuss this is Dr. Michael Brady from the Terrence Higgins Trust, and from Los Angeles, Jed Kenslea, the Senior Director of the AIDS Healthcare Foundation. Gentlemen, good to have you both here. Jed Kenslea, can I start with you? Do you believe that the battle for use of condoms has been lost, that actually there are better ways now to prevent HIV/AIDS?
Well, I hate to rain on Patrick's parade, but if he feels the battle for condoms has been lost, at least under U.S. FDA guidelines, then he won't want to do PrEP, because PrEP technically requires condom use as well. It's a 4-part prevention strategy, as Dr. Dimitri Dasakoulis had mentioned, and kudos to them because they have very aggressive advertising and marketing in the city that has PrEP plus condoms. But PrEP technically is a negative HIV test to start, a baseline negative HIV test, daily adherence to the pill, periodic, i.e. 3-month follow-up negative testing to make certain that the individual remains HIV negative, and continued use of other prevention strategies, i.e. condoms. So technically, at least under US guidelines, US FDA guidelines, PrEP includes condom use.
So, Michael Brady, when you see the advert, for example, in the piece that we've just watched of the guy going out, he says, "I like to party," and that's his answer to it. Do you accept it is sometimes used as a party drug, even though it shouldn't be?
Well, I think we need to be careful about the language we use around PrEP and not forget the fact that this is a highly effective, very well researched, successful HIV intervention. You know, the research studies and the evidence behind it is robust, is solid, and as you mentioned before, with the Lancet paper has been published in many peer-reviewed journals. So I think the context of that advert has to be realised now, and I'm assuming that that's something that's aimed at a community of lay people.
That's how he's selling it, isn't it? That's how he's selling it. You can do this if you want.
Well, I think what's more important, I mean, we can choose again which word to pick up on. We can pick up on the "I like to play," or we can pick up on the "I like to be safe." And I think that's the important thing, that what PrEP gives us, or gives those men who may well be at risk, is another option to remain safe and to use it in conjunction with condoms as well. Not to remember that this is not an intervention to be used by itself.
Jed, would you agree then with the person we heard in that report who says it's a scandal to know how effective this is and to not have it freely available, for example, here on the NHS?
Well, we actually support the NHS on that. My understanding is that the medication isn't even really approved by your government as yet, but we would approve that. I mean, we, AIDS Healthcare Foundation, my boss, Michael Weinstein, made the offhanded comment about a year ago or so, referring to PrEP as a party drug. And that sort of inflamed the internet and so forth. But, you know, our physicians prescribe PrEP. We have a chain of 37 AHF pharmacies in 14 of the US states. They fill prescriptions for PrEP. We believe that PrEP should be a decision made between a provider and his or her patient,
just
not
to clarify
a
then,
blanket community-wide.
would your organisation withdraw that claim, if you like, that it's a party drug? Do you think that was wrongly worded?
No, I don't think so, because what has happened since FDA approval in July of 2012 is the goalposts have moved in that PrEP used to be a daily medication. Now it's really being promoted for situational use. Now, mind you, there are studies going on now that are exploring that very issue. But under current guidelines, it should be daily adherence. And people are now suggesting, which we believe that ad says, that you can do it for 3 or 4 days.
And Michael, sorry, when you hear it's being used for situational use, there'll be people watching this who say there are many diseases that, quite frankly, aren't preventable, that NHS money could be spent on. You can't stop cancer by using a condom. You probably can stop HIV. Well,
let me just address a number of those things. I mean, the first thing to say, even going back to the initial assertion about the condoms, the battle of condoms has been lost. I think that's not true. There's lots of good evidence that have shown that condoms use has been very effective in slowing the pace of infections, but it hasn't stopped them. And in this country, certainly, the same number of gay men are being infected with HIV every year. So whilst condoms have not made that any worse, we need to step up, and that's where PrEP comes in. I think the other thing that's very... It is really important just to make the point about the intermittent use. There are 2 excellent recently published studies that have shown exactly the same efficacy of PrEP, i.e. 86% reduction in HIV transmissions. One was the PROUD study, which is regular PrEP use, and one is a study done in France primarily, which was the IPAGAY study, which showed that you could use it intermittently. So there is good, robust scientific evidence to show that situational or on-demand use of PrEP is just as effective.
But you're talking about its use for gay men on a daily basis?
Or an intermittent basis. It works just as well.
Because 1/3 of all HIV diagnoses here are with British Africans, both straight and gay. So the moment you start introducing these, if you like, arbitrary prescriptions, you're trying to decide who merits getting it and who doesn't.
I don't think so. I mean, it's not an arbitrary prescription. If we're talking about the gay men group to start with, and I'll come on to the 2 other groups, which is important not to forget, we already have lots of evidence which would enable us to identify those gay men who are most at risk based on their sexual history, whether that's on their reports of unprotected sex or previous sexually transmitted infections. So identifying those gay men who are most going to benefit from PrEP is relatively easy. We're doing it already, and those of us that have been involved in the PROUD study in the UK have found that very easy in terms of recruiting to that study.
So you basically have to apply the same thing to
which also impacts on the other important factor around the NHS funding of this. And I think we mustn't lose sight of, you know, our healthcare system is funded differently from the States, and it is important that cost effectiveness is brought in so that it's a fair comparison with other things that we have to spend resources on.
Fair point. Thank you both very much indeed. Thank you for joining us.